Welcome to the Medical Device Made Easy podcast. Here is Monir El Azzouzi from easymedicaldevice.com, and today we'll talk about audits. So we have, we are executing a lot of audits with Easy Medical Device also. I have executed a lot of audits myself with a lot of other companies. So we have mainly always find the same issues, if I can say. So it's really the low-hanging fruits, that things that everybody can find. So mainly today we'll try to see what are the common issues within the ISO 13485 audits. And I have with me for that an auditor that is doing a lot of audits, which is Adam Isaacs Rae. So Adam, welcome to the Medical Device Made Easy podcast.
Thanks for having me, Monir. I'm not sure about how I feel about being identified as an auditor, but that's fine.
I mean, for me, you are auditing a lot, so it's considered as an
That's okay.
auditor. I mean, you can do
That's
any
okay.
type of audits, and you are
Yeah,
considered as an auditor. But
that's fine. It doesn't reflect my personality, though.
yeah. I mean, you are a nice auditor. We should not
Thank you.
not think that you are the mean one that will, be not happy always and not smiling, etc. So let's say you are the nice auditor. We have
Thank
on
you.
cybersecurity, we have the black hat and the white hat. So let's say you are the white hat of auditor. So it's just great.
That's quite good. I like that. That's good.
Great. Adam, for people maybe that don't know you, can you just maybe introduce quickly yourself, and then we can find out what are the common issues in audits?
Yeah, sure thing. So, my name's Adam Isaacs Rae. I have my own consultancy business called The Other Consultants. I am a quality and regulatory consultant, have been for the last 10 years. I predominantly work with manufacturers of medical devices as well as kind of other organizations in the industry that take up, say, roles as economic operators and implementing regulatory requirements, so MDR, as well as implementing ISO 13485. Lots of remediation for, say, legacy devices that have been on the market with no design controls. I also have this other hat, like my white hat, we'll call it now, where I do some certification audits for certification bodies, and I also conduct internal audits for organizations from an independent perspective to kind of help them get ready for stage one audits, stage two audits, or just generally part of their internal audit cycle.
Yeah, exactly. So mainly, as I've said today, we will discuss about non-conformities that were raised for some ISO 13485 audits, but maybe for people that are not like well experienced with audits. So can we just make a summary again? What is an audit? As I said, just for the newbies that are starting, because we
Yeah,
have also a lot of students that are learning and that are trying also to become quality and regulatory affairs people. So now here, just to understand what is an audit.
yeah, sure thing. So audit, it's defined in ISO 19011, which is the guidelines for auditing management system. That's the general auditing standard, which essentially any ISO standard is an audit against that should be conducted against it. The standard I have it in front of me, which is what the every auditor will expect. Just top tip: every auditor will expect you to have a copy of the standard. That is a question people auditors often ask, and I often ask it myself. So I'm practicing what I preach. So ISO 19011 defines it as a systematic, independent, and documented process for obtaining objective evidence and evaluating it objectively to determine the extent to which the audit criteria are fulfilled.
And
So
in layman words,
essentially, checking something against something to see if it
exactly.
is right or not, basically.
Exactly. Here we talk about ISO 13485. So mainly is checking that what is written ISO 13485 is applied within the company. So this is
Yep.
mainly how this should be done.
Yep.
So we talk about audits. We have multiple types of audits. So mainly here, what will we focus on? What we will be focusing on now?
Yeah, so we're discussing predominantly just for this podcast. There's loads of different types that can be done. Again, ISO 19011 goes into that in really good detail. So the type of audit we're discussing today is what we would call like a conformity audit. So you're assessing for auditing for conformity, not non-conformity. You're auditing for conformity. I think that's a key point. Any auditor should always be looking for the conformance, not the non-conformance, essentially. The other types of audits that exist are audits for improvement. So if you're just looking at a process area that you want to improve, for example, because you have some changes coming up, some design changes, for example, to a manufacturing flow, and you want to make some improvements to it, you could say, we're just going to schedule an improvement audit, and it means your auditors can go into it without having to think about conformity. They can go in with a really creative mindset. So I'd say, but for today, we're really just discussing auditing for conformance.
Unearth the pulse of the medtech world with MedTech Conf, a dynamic platform featuring global events on medical devices, biologicals, IVD, and pharmaceuticals. Stay informed, stay ahead, connect, share, and elevate your knowledge. Become an official sponsor. Make your event shine on the map. MedTech Conf, your key to the medtech universe. Remember, the future is now, and it's at your fingertips with MedTech Conf.
Exactly, yeah. Because as we said, so the idea is that are we conform to the ISO 13485, and mainly what are the main issues? And this is mainly the topic of today is what are the common issues when we are auditing for ISO 13485. So this is mainly the idea of today. And as I've said, Adam, you are making a lot of audits with people. So mainly, I suppose you have your own top list of what are the issues that you are always discovering. But as I'm, it's important to say that this is mainly the list that we have built in, but there are a lot of issues that can be found. The only point that you have to understand is that what can be great at the end of this podcast is mainly that you take those issues and you verify them within your company, because as we said, this is sometimes the low-hanging fruit. It's something that an auditor, he hasn't even stepped in within the audit room, that he knows already that he will ask you that, because he knows that you have always issues about this. One of my first one that I had as an auditor that I was always asking is to ask for the quality policy of the for the people. So do you know the quality policy? Because it's mandatory that they have an understanding of the quality policy or where to find it. And some people say no, because it's a low hanging fruit. A lot of people will have no clue what it is, no clue where to find it. But I knew that, so I knew that I can get just a non-conformity just by asking this question, and it's fine. So, but yeah, I mean, this is mainly I'm not a certification auditor, so I'm just doing internal audit or audit for clients. So I'm not doing that in the purpose of getting any certificate for people. But yeah, this is like the example of low-hanging fruit or low non-conformity that you can find easily. So
Absolutely.
Adam, let me know now what is your top list here.
Cool. So I suppose we could kind of briefly discuss where the requirement for auditing comes from 1345.
Yeah, sure, yeah.
Because that kind of often acts as a bit of an input from it. So again, got my copy of 1345 in front of. Clause 8.2.4 defines the requirements for internal audit. So that we've got 19,011, which says, as an auditor, this is how you must act. And then you go to 1345, which is saying, to have a 1345 quality management system, this is what you must do, essentially. So this is where the requirements that we are going to discuss come from today. And some key parts of that really I always like to point out to people is with regards to the audit plan, the audit program. We call it an audit schedule. 1345 calls it an audit program. And it says an audit program shall be planned, taking into consideration the status and importance of processes and area to be audited, as well as the results of previous audits. So that's kind of really saying you need to be very strategic in how you're kind of defining that audit plan, and that it needs to consider key processes, key areas, as well as using, say, analysis of data to understand what the areas of non-conformance are in your business. So that's a really key part of looking at this. And then also there's the kind of generic parts of the standard which say, you must maintain records on this throughout. So
exactly.
Yeah.
And what is important, as you mentioned here, is that you have this certification audit that is done by an external company, by an external certification body, and you have these requirements also within your company to do internal audits within your company. So meaning that you have to check yourself that you are good. It's mainly that. And this is sometimes a schizophrenic thing. Like, I see an issue, but should I report the issue? It's like it's the main problem here. Like, let's make a report, an internal audit report, blank with no issues at all, so that we are looking like we are good. But yeah, it's better to show that there is some issues, then to let the auditor find himself some issues and then discover that your internal audit process is not really working correctly.
Yeah, absolutely. That's the certification auditors, external auditors, notified bodies, regulatory authorities. They are looking to see that your quality system is working as it is intended, and that you are detecting issues before they are. If they look at audit reports or CAPAs and everything's there, they find non-conformances, but you can say, well, I've got this open, everything's fine. Then they say, okay, your QMS is working. I'm only here to ensure your QMS is working, so that's fine. And then it becomes an audit about checking for bottlenecks, and that's really where internal audits become quite powerful, or external audits become powerful as well, because you've got this person there who has a huge amount of experience. They see loads of different devices, loads of different quality systems, paper-based, EQMSs. You have them for a day to look at your QMS. It's kind of that cultural side of things where audits, I would like to see the culture change between, it's not bad to get non-conformances all the time. They're really about finding that improvement. And, if you have a QMS which is working, that culture changes because the auditor sees that it's working, and then the auditor can give you some observations and say, well, I don't think that's risk-based enough. Maybe strengthen your problem solving, and your QMS starts to work better, and you build the relationship with that auditor as well.
Exactly, yeah, and mainly this is the idea of testing yourself that everything is working before you can go to the real audit with the certification body. So it's good to discover those issues at that moment instead of hiding them. So yeah, it's better. Okay, so can we start with the non-conformities? I think what we can do is, because before we discussed, we have 5 clauses on the ISO 13485. So what we will do is that we'll try to identify one issues for each clauses. So each chapter of the ISO 13485 to identify what are the most the biggest issue on each of those clauses, so that we are covering, if I can say, all the ISO 13485.
Yeah, sure. So we can break out more information after this if people really want it,
Exactly,
but I think for the purpose of this, then we're right to keep it limited. So
exactly.
And we can also kind of look at what to put right on it. So I'll go right in to the first clause. So the clause from the analysis of which I looked at that was kind of most commonly cited was clause 8. I ran a little poll on LinkedIn about this a few weeks ago, and it was really interesting just to see what different people thought would be the highest, and industry was pretty spot on. I think it was more that people thought clause 7 would be higher than clause 8, but I just again from what I looked at, the sample which I looked at again showed clause 8 was the highest one. So we'll start with that. The area which clause 8 identified was around CAPA records.
So, remind us, what is clause 8?
Measurement, analysis, and improvement.
Okay.
So the clause which contains internal auditing, CAPAs, so corrective action, preventive action, reporting to regulatory authorities. Complaints, yeah. So quite a big kind of subsection of the QMS. Really important, doing that measurement kind of side of things. The area that I found was that CAPA records was really related to CAPA records, that they were not able to demonstrate kind of effectiveness of the actions taken of non-conformances that were previously identified. So non-conformances raised, corrected, corrective action identified, closed, and then kind of no follow-up done to determine the effectiveness of that corrective action. So that is the area that I found was the highest, and that really makes sense to a lot of what I see in industry. It makes sense in terms of the non-conformances, because if you're not verifying that the corrective action you've taken is effective, then it will recur, because your corrective action in itself may have been ineffective, essentially. Exactly. So it kind of makes sense.
Exactly. So I mean, I would have been surprised if Kappa was not the first one, to be honest.
Yeah.
Yeah. Because Kappa is always the issue. Not the issue because it's a tool to solve issues. The only problem is that Kappa is considered by people, it's not true, but considered by people as a heavy tool that you have to document a lot of information, collect a lot of data, do a lot of analysis, interview people, do some 5 whys, etc., all those things, identify some actions, close those actions. And the thing is that a lot of imaginary on the people is that as soon as I close all the actions, I'm done. It's finished. But
Yeah.
we see a lot of my experience also. We see a lot of issues that happen again, the same type of issues again. And we
Yeah.
said, yeah, but we had already a kappa before. And they say, yeah, but it means that your kappa was not effective at all, or you didn't really tackle the right issue. I mean, the famous one is when you say, oh, it's a human error. And what we are doing is
Uh,
that we are doing retraining of people or these kind of things.
yeah.
And then you retrain the people. You say, have they been trained? Yes, effectiveness monitoring. Yes, it's been trained. So,
Yeah.
and then few months later, you have the same issue that appears again and again and again,
Mm.
because mainly retraining is not really something that is really effective on the long
Yeah.
run. But yeah, kappa is really something that has to be taken into more seriousness or consideration for more training. But yeah, I suppose as I say, it's not a surprise. But for
Yeah.
this one, what is your suggestion to really tackle that?
So effectiveness verification is something that maybe quite a lot of people might disagree with this, but I believe that when you identify a deficiency, that you can develop the effectiveness verification for that up front. You know, you can look at it
Yeah,
and say, to make sure this doesn't happen again, here's what I'm going to do, which could be, you know, things such as you could audit that process,
yeah,
take some samples on it, you could put a little trending system in place, or just a follow-up review to review all the records. You know, if you're going to review records, for example, then make sure there's the statistical rationale to it, because you know there's no point in saying for this process which generated this deficiency, I'm going to sample 2 records out of 6 months that generates 2,000 records. It's not statistically relevant. So I would say the kappa process, that effective, the problem that I see is the effectiveness verification, like you said, is the afterthought often. Whereas it needs to be moved up front to say, how are we going to make sure this is effective? And so I almost recommend defining that up front when you're saying problem statement. You know, a really well written problem statement is as you know from, you know, kind of human error and stuff like
yeah.
that, like you said, a really well written problem statement goes such a long way, because if your problem statement's not great, then your investigation isn't great, and then your root cause analysis also is not great, and then, you know, if your root cause analysis isn't great, your effectiveness verification, if you base it on that, is not great. So I always challenge people to develop effectiveness verification methods, just a few examples of it up front when that deficiency has been identified. And then it challenges people to say, right, we found that this glass should have been, you know, this glass, for example, should have been clear, but it's green. How am I going to determine if what I put in place is effective or not? And you could say, well, as long as the first 10 production runs produce clear glasses, my corrective action has been effective. You know, that
Exactly.
you don't need to do root cause analysis to understand that's how you'd check if that's effective.
Exactly. But I think, as you mentioned, you have to be really proactive on that. It's true. And I think to avoid also those type of issues, training is really important.
Mm.
Why we are saying training? Because yeah, you have to be trained for kappa, but not training just, oh, read the procedure and then you can do it. So when I
Mm.
say training, is more about participating to real training that is explaining to you what is this process, how it's working, and making example, case studies, etc. Because what I see also a lot is that the people that are receiving the kappas are like first the quality people, but
Mm.
sometimes those quality people have no clue what is the problem. It's a production problem, so normally it's a production guy that should solve the problem and not a quality guy that
Yeah.
has no clue how to solve the problem. They are asking him, do an effectiveness monitoring. Say, I mean, what can I do I don't know the process. How can I do all this? So this is the point. You should train the people that are really here, that are as close as possible to the problem so that they can solve it, understand it. You still need to have the support of quality person, but
Mm.
to investigate or do all those things, quality person will not help you. They will just say, yes, you need to investigate, but as they don't know the process, how can they investigate if a machine is failing or if a part is not done correctly, as you said, is green instead of clear, etc. So
Yeah.
training is also, I think, something that is important to emphasize.
Absolutely. Yeah. And a fundamental element that underpins the effectiveness of a kappa system in general is having the competent people, the right people, at Gemba, the place of work, you know, where it happens, where the non-conformities happen, instead of the people that don't understand the process. it's absolutely key. So, but
Exactly.
yeah, effectiveness verification, it makes sense to what I see, because then that is also an area that filters out into other elements of the QMS deficiencies that we can go into as well. Because not only if that is ineffective, then the elements that corrective action was trying to resolve of this quality system are affected as a result, because those non-conformances keep happening, but they just are realized in different ways.
Exactly.
Hmm.
Okay, second one.
Cool. Second one is clause number 7. So
Okay.
we'll go through this. So clause number 7 was that supplier notification agreements were missing, and that is around change control quality agreements with suppliers. And you and I discussed this quite a lot, because it's an area that just causes so much bother all the time. One of the areas is around the provision of change control within agreements with suppliers, and which suppliers need to have that in place, which suppliers don't need to have it in place, and then the wording on what that seeks to control. So it's 7.4.2 of 1345 that kind of makes that mention to say there shall be a provision that controls change prior to that change occurring. And that is the most common area that I identified from clause 7, which says this is an area that we see manufacturers struggle with. I think that may be due to the nature of the way a lot of businesses run now, to be honest. I think a lot of suppliers don't like signing up to that stuff as much now because of the nature of business. For example, Amazon, you're not going to get Amazon to sign anything like that. It's just not going to happen. A lot of larger manufacturers as well, if the medical device manufacturer doesn't have a significant spend, then they're just going to say, no, we're not going to notify you of this because it's not realistic that we do that. That, I think, causes a lot of issues for medical device manufacturers when they try and comply with this requirement, especially if the notified body or certification body is applying pressure for them to have some provision of that change in place. That is definitely an area that I think a lot of organisations need some assistance with and some guidance on. So I think it's maybe an area we should follow up on after this as well.
Yeah, exactly. And I understand those people back because mainly uh, it's always the fight between David and Goliath. It's like
Yeah.
you are a small one, they are big, and you ask them to do an audit first. It's like they are pushing you for 2 years
Yeah.
after. I mean, you ask them to sign an agreement. They can wait 6 months or 8 months just to review and to check that. You ask them to do some audits even with a notified body because they signed it. They agree. They said no, we have no time for that. I mean, it's normal life, if I can say. It's normal
Yeah.
life for things.
Yeah.
And yeah, you have to find, I suppose, some parads, the way to really deal with all those things and have a solution, because I suppose you as an internal auditor or a notified body, when they are coming, they are verifying that what is written on the ISO 13485 is executed. So if it's not executed, even if you are trying a lot, I mean, it's not executed, so they cannot just say conform. They will say not conform at all. So it's mainly
Mm.
the issue. But do you have a solution maybe, or do you see something that they can do, or do you
So
have the magic
yes,
pill or the magic thing?
absolutely not. There's no such thing. But the key phrase within that section of the standard for this is that when it refers to it, it says purchasing information shall include, as applicable, a written agreement. When it refers to shall, generally in these ISO standards, that means it's a mandatory requirement. So if you were to read that in isolation, you'd say purchasing information shall include a written agreement. However, the standard has implemented that key term, which is as applicable. And that is the basis of which manufacturers should use to justify themselves out of this. Where possible, a manufacturer should try to have this stuff in place, because it is, I understand, and we both understand as medical device QARA guys, we understand why this requirement's there. It's to notify the organisation of changes in the purchase product prior to the implementation of it. So it has good intent. It's to control the provision of products to a medical device manufacturer, essentially, but just not doable all the time. So if a manufacturer writes in to say their quality procedures that for, really the basis of risk should be the way to manage this, very, very high risk suppliers, it should be the provision taken. If a very high risk supplier just says no, and they're a single source, then that manufacturer's in a little bit of hot water. Then they may need to do more incoming inspection to ensure that they're able to 100% verify whatever it is they're buying against what's on that PO, essentially. So I'd say it's a case of case by case basis, but writing into your procedure, being clever about your procedure. Don't say that everyone will have that,
Exactly.
because you'll end up with issues. But also, when you are writing it in places with agreements, I see this quite often. Organizations say you must notify us of changes in the product, but there's a key word from the standard which is prior to. It needs to be prior. They need to notify you prior to those changes. Otherwise, they could send it and say 6 months later, "Oh well, we did tell you about that." And the standard is, I've found myself receiving and giving non-conformances because these things say they don't say the word prior. It has to be done prior to.
Hey, just a second. Do you need a EU, Swiss or UK representative? Then choose Easy Medical Device. We can represent you and also become your importer. Contact us at eo@easymedicaldevice.com. And it's logical also. I mean, they will not inform you that the change happened when the change was already done 2 months or 3 months after. So
Yeah,
this is
yeah,
this is important. But
yeah,
yeah, your mention about to do a 100% check is mainly the thing that I'm also advising to some customers to say if you cannot be sure that everything is okay or they are not really signing on this, so to do that. Also, when you do an internal, not an internal, a supplier audit, when you go to audit them, the idea is to take the contract with all the requirements that you have defined with them
yeah,
and verify that they are applying them. So asking them, was there any change about this product since last audit or since last year, whatever, and then they have to tell you yes or no. And if they say yes, they ask them, did they notify you about that? And then you can raise also a non-conformity to them on an audit. And then you can
yeah,
share that also with the auditor to say, we know that because we have also raised the non-conformity with them and we are trying to solve that. So it's why everything should be written.
mm,
Normally, we know that some people say, oh, let's hide some information because it's not good to see that on a report. But if it's
yeah,
hidden, it's not seen. So the auditor will say, where is the proof that you have find that? Where is the proof you have done this, etc. And you see here is a case where this can help you to have everything written. So even if it's an issue, you have to write down some of the findings.
yeah, absolutely. Okay,
Next
next.
one.
Next one. So we'll just move down. We'll just go to class 6. Nice and logical. So the next area was. So these are very close. So I'll try to mention both, and we'll kind of try and do it a little bit quickly because these are very very split. So, they was and kind of competency based around the competency specifically around internal auditors conducting
Yeah,
audits against 13485. Makes sense.
yeah, it makes sense.
This is an area where you often see auditors. They are auditors. They've done, say, training to 9001, for example, but they've not got any evidence of transitioning to ISO 13485, for example, and the requirements are very different. And a lot of organizations say they could they could start to add 13485 into the requirements, although a lot of organizations that have 13485, some of them aren't necessarily a medical device manufacturer. Sometimes they have something to do with it, like the space, but they choose to get that standard. They just say, well, this person's got a qualification in auditing 9001, so they can audit 13485. That is a very, very common area. And it creates risks because there's the very nuanced elements of 13485 that are just not in 9001 at all. Sterilization, validation, for example, is one area which is just not even covered in 9001 at all.
I think you can be qualified as an auditor or internal
Mm,
auditor because you know the technique to realize an audit, to send the
mm,
agenda, to ask the right questions, to do all those things, which is general to any audit mainly. But yeah, when
yeah,
we are going to each standards, if I have to audit for 13485 or 9001 or 62304 for software, etc., if I have to audit for that,
yeah,
I have to understand and to know the standard and to know what are the different clauses and to understand to interpret also those clauses. So it's why it's important to have this speciality. I mean, generality on audit, but speciality on the standard that you
yeah,
are auditing. One of the common issue that I find on this for me, as you've said, is mainly also that an audit, a quality manager was auditing his quality management system. So which
Yep.
means that you cannot audit what you have done. You have to have the four eyes principle. So if you have done something on the quality management system, like creating all the procedures and doing all the trainings and doing all the things, etc., at the end you cannot audit yourself to say I have done a good job. I mean, it's logical that it's not working. So this is one of the main issue that many I find because I mean, here is the story. So people are getting a certification audit, they get audited, they find out this issue with their quality manager, etc., and then they contact us and say, "Oh, can you audit us for internal audit because we got a non-conformity because our auditor is not qualified to be auditing the work because it's the work he has done." I'm not saying the guy
Yeah.
is not qualified as an auditor. He's not qualified to audit the work he has done. So it's only that the issue. It's mainly the point. Did you have this issue
Yeah.
also?
Yeah, I am actually questioning if you have access to my notes
Ah,
because
really?
that's
Okay.
yeah, because that's one of the things that I just was the management representative regularly conducting audits was the other area that I just wanted to slowly kind of bridge into, and that is again fundamentally as long as there's a ability to say there's no conflict there, but
Yeah.
inherently the management representative is responsible for the quality system. They know typically they know way too much about it
It's not
to
only they
be
know, they
you
sign
know
normally also some
yeah
documents. So it's like I sign a
yeah
document and I will audit the document that I have signed. So it's
yeah
makes no
it's
sense.
and I wrote a little newsletter on this earlier this week because it's one of those things where by by doing that, a lot of organizations do it. Like you said, you see it a lot, I see it a lot, and I understand why smaller organizations in particular do that. But it's almost they rob themselves a little bit because you are then not getting the benefit of independence. And independence,
Yeah,
as we see when we do audits for one another, Monir, independence is so powerful.
exactly.
The voice of an independent, as well as just that perspective, is so powerful.
I
And
mean, you arrive with fresh eyes, you ask
yeah,
stupid questions, as I said,
yeah,
and those stupid questions raise like big issues. I mean, it was always like that. You arrive, you ask a stupid question because you think, I know that everybody knows, but I will ask myself the question, but you find out that nobody knows. And
yeah,
at the end, it's like making the biggest issue of the company. So it's why coming with a fresh eye, independence, and knowing also what happen. I mean, what happening with other companies you can benefit from that also. So it's why it's important to take this advantage.
yeah, absolutely. So I'd say that's
Next
for
one.
number six. We can move on. So clause
Yeah.
number five. Clause number five. The most common issue that I see from clause number five is around quality objectives.
Okay.
So, and that's probably not a surprise either for yourself.
Yeah. I mean,
Uh,
there is a lot of misunderstanding between quality objectives, policy, quality planning. I mean, all
mm,
those wordings are making confusion for a lot of people. So yeah, I understand that.
yeah. So the specific area that I see around quality objectives is that the quality objectives there's a very specific requirement from the standard which talks around the they must be measurable.
Exactly.
And far too often and very commonly, a lot of quality objectives say things like improve customer satisfaction.
Yeah.
For example, that is improve it from what to what, for example. And that's where this analogy kind of smart, specific, measurable, achievable, realistic, time bound kind of is something that I preach to people to say that is the basis of good quality objectives. And then also with that not being measurable is also a lot of organizations have way too many quality objectives. I find sometimes there's
Yeah.
way too many, like 10 to 12, and it then means they spend all of their time reporting and not that much time on really kind of able to achieve them because the quality and regulatory departments always have resource constraints like any department. So reduce the objectives, make them more meaningful.
Hmm.
One objective I love is when you say get a certification, for example. So if you're implementing ISO 13485, use that as a quality objective. It's realistic, it's measurable. You measure it by whether you get it or not, and it's also very relevant to the business. Like
Exactly.
quality objectives, they're a really powerful way to bring the quality system to the forefront of the business because you can say, what are we trying to achieve? Reduce scrap rates, improve effectiveness, for example.
I mean, when we are doing audits, I think this piece related to quite objective and etc. arrive nearly at the beginning when we are looking at the because my
Yeah.
process, for example, is at the beginning I arrive to look at the management review. So then I look at the objectives, the policy objectives, etc. And sometimes just by looking at that, you will know if the company is really well organized or if they know really
Mm.
what they are doing. Because when you arrive and you have a company that is gives you, here is my quality policy, like 4 blocks of quality policy, satisfaction of
Mm.
the customer, compliance, what else? Improvement,
Improvement. Yeah.
people improvement or training, whatever. I mean, all those like 4 blocks, and then below those blocks they put for satisfaction of the customer. This year I will do that, which is like
Mm.
implementing a feedback system with stars, and it will be done by March 2025, etc. Plus, I will send a report to people to get their information about how we feel about the status, etc. I mean, you see, they
Yeah.
are really aligned policy, objectives, and then they plan it with really the timeline and everything. And when you see that, I
Yeah.
say, I think I will not find too much on this audit because they are really
Yeah.
great. I mean, they are starting well. So this is also
Yeah.
how you can also show to an auditor that you are really a good, I mean, good at quality, if I can say for this. But yeah,
Mm.
measurable, smart, as you mentioned,
Smart.
is
Yeah.
something that is sometimes lacking, because even when you said use the fact that you will be certified for ISO 13485, I have people that
Mm.
write that, but there is no timeline, there is no
Yeah.
purpose. I mean, there is no how they will do that. There is no, they just say, oh yeah, this year we'll try to get ISO 13485. Okay, but how? Can you show me more detail about that? And this is
Yeah.
where it's like just a cosmetic objective, but it's not really realistic, because they are not
Yeah.
really putting any effort on it.
Yeah, that's it. And with that as well, just to tag on to that, another really common area in five was management review inputs not aligning with the standard.
Yeah.
So the 5.6.2 off the top of
It's,
this,
you mean the input
uh,
and output, or? Ah,
the
okay, yeah,
inputs and
yeah,
outputs, yeah. So just that nice basic word template that all consultants have basically, which is just a copy and paste of the standard. A lot of organizations seem to try to create their own version of it, and they miss things that the standard is requesting. And then the final statement to say my quality system is suitable,
yeah, yeah.
adequate, and effective. They
But you
those two
have to have
areas,
this sentence, and you have to ask this sentence to your management, top
yeah,
management, and they should say yes or no. They should say whatever,
yeah,
but they should say answer to it. Mainly, the issue I see on that is also that sometimes they try to mix management review, which is a quality topic, to business
mm,
review also. So they try to
yeah,
have both things together just to save some time or to do just one meeting about it. But
mm,
yeah, try to make it separate, like management review is really management review, because it will be shown to a lot of auditors. So if you show them also the business part, so it will show numbers and everything, which is maybe something that you might want to keep confidential. So yeah, it's mainly
mm.
something to be careful on.
Yeah, yeah, and which is okay. I think if they want to, I think if organizations want to integrate it, then I think it is okay. But it's that thing of that presumption of conformity kind of thing that a lot of people speak around as, even though a standard is safe, like this is kind of going a bit wider, but even if a standard is harmonized, there will always need to be traceability to that individual standard.
Yeah,
And it's just like that, even if you do a business review and your business review is great, the auditor is still looking for the traceability to that
exactly.
requirement. They sit
Exactly.
with the standard in front of them. We need to see that.
The
So
only thing I
it's
don't like with the business review is the fact that we talk a lot about money, and this
mm,
can misalign also the message between what we are saying on the management review and where we are saying here, oh, we don't have enough money for quality, for example, but we will
mm,
put more money for marketing, and then this will not show a great message also. So it's why I try to
yeah,
separate that just to avoid
good
this kind
point.
of misunderstanding between with the auditor.
Yeah, that's a good point.
Okay, last clauses.
Last but certainly not least is around scope of the quality system in
Okay.
clause number 4. So the two kind of areas of it, the scope does not align, and the scope in the quality manual does not align with that scope on the certificate, for example.
So scope means like design, development,
Yeah,
manufacturing,
yeah,
delivery, maintenance, blah blah. I mean, all of what you write on your ISO certificate. Huh?
yeah. So very commonly, the scope that organizations reference in the quality manual, because the quality manual kind of looks at it from two perspectives. It says what's the scope, so where where is the site that makes this, how many people, what is the scope of, but then what I'm referring to is the scope of the QMS, often in the quality manual, does not align with that in the certificate. And that is mostly a doc control issue, I believe, from what I see. But, you know, there's, if you say your scope is the provision and development of software as a medical device for retina scanning, for example, then that it should be word for word what is on your certificate. And that is often, there's often a few little words missing or a few little words added in that kind of cause it to differ, and that always is a source for non-conformances with audits, because it's what you're being certified on, it's what your QMS is being certified on. It needs to be really tightly controlled, and it's just so common that
I
I
had
see it.
this issue with one manufacturer. He was early on his process, if I can say. He was like already his company was in the design and development phase of this product
Mm,
prototype and everything, and he wanted already to get an ISO 13485 certificate. So then the auditor came and they audited the company, but they said we cannot audit more. I mean, because they stop their process at design and development. There is no manufacturing, no delivery,
mm,
no whatever. And they say, oh, but we want to have all this within our scope. They say, but I cannot give you that because I don't have any manufacturing, have no
yeah,
delivery, no warehouse, no check, no whatever. I mean, how can I verify all this? So then they gave them the certificate only for design and development. And they said, next time when we will be moving forward for this, then you can get the rest. But yeah, they were a bit not happy because they wanted to have
yeah,
a complete certificate. So make an understanding when they are coming to audit you, they audit you for the full scope that you have defined on the application. So if they come and they check that what you have done is not fully what is written on the scope, I mean, they cannot give you the certificate for that. So it's mainly the issue here.
yeah. And it's really from that planning perspective, it just creates issues if they don't align. It's so annoying because they need to then say, can we essentially expand that scope on this audit, or can we reduce that scope in this audit? Or it means, like you said, your certification is going to be limited. It's just a very kind of very annoying, inconvenient thing to get wrong that just can have some implications. And you know, the auditors would often, a lot of the time, they say, oh well, we can't do that today, I need to come back, or can we
Exactly.
do, I can only, you know, I need to book another half day in to verify this, because they need to verify before they can do any scope extensions as well, because it can go down as that depending on what they find. So I'd say the method of which I see is quite good for doing that is to control, because the requirement for your scope in your QMS comes from the quality manual requirement in 13485, so 4.2.2. So it says the quality manual shall document the scope of the quality management system, and then your exclusions or non-applications. A lot of the time, people just put it in one quality manual. Quite a nice thing that I see is people control it as a separate document, which is referenced in the quality manual. So say under the scope section in the quality manual, say, please refer to this document. And it's a standalone document that's really controlled. It's not kind of in amongst the quality manual to be kind of a little bit messy and convoluted. It's just a standalone document, which is controlled in its own, it has its own version number, and it's only uprevved with the certification, basically.
Exactly, yeah. And
Mm.
so yeah, be careful of all this because, as you said, it can be disappointing. Also, budget-wise, because if they have to come back, if they have to do so, it can
Yeah.
be also, some kind of annoying for your management. So don't be the one that make this mistake. Try to, otherwise they will keep that from your salary. So it will be
Yeah.
not really nice.
No
Okay,
bonus.
so I think we covered all the five clauses. So
Yeah.
how would you like to summarize all this now?
So I think the first thing I'd like to say is that non-conformances are totally natural, and that it is very, very, very seldom do people just sail through audits and get zero non-conformances. And the people that do, when they do sail through non-conformances, credit to them. It's great. However, I think it does create a culture of not wanting to get any non-conformances, and then that kind of really creates further, can compound that culture of trying to hide non-conformances, like we were talking around. So I think the first thing is to accept that this is normal to have them. It's totally fine.
You should have them. I mean, I really arriving to a company and they have no non-conformities during an internal audit or even certification audit can show that maybe something went wrong here because
Yeah,
they should find something. It's not like
yeah.
you are
It,
not
it,
perfect.
Yeah, it creates that question. If there's no non-conformances, no customer complaints, no CAPAs, nothing going on, then you start to say, is this system capable? So you actually look at it from a different perspective. Then you say, what's going on
Is
here? If
this
there's
company
nothing,
selling something at the end?
yeah, what is
How
going on
many?
here?
Exactly. Yeah.
Yeah, and it also creates the other side of it where saying maybe you're spending too much resource on things because your system is maybe not risk based enough, because your
Exactly.
system should be picking up non-conformances because you should be able to trend the low risk things. The high risk things should be dealt with properly, but the low risk things should be getting picked up in audits, dealt with, corrected, move on with life. So say that's the first thing is really we all need to just accept this as part of life.
Exactly.
QARA professionals do, but I'd really say for people that are involved in the commercial business of the medical device companies, they need to realize that this is so common that this happens on audits as well as technical file reviews.
Exactly.
Very
It's normal.
it's normal and it's just the way things are. So, and the best people that I often work with are those who realize that this is normal because it creates a good culture to work in where you can just get stuff done. You don't need to worry about stuff being perfect because it never will be, but it allows you to progress things quickly in what is a very slow industry sometimes. The next thing as well is the last two parts is that a good internal audit schedule or internal audit program and competent auditors are the basis of a good auditing system and a good quality system. Basically, like we said throughout this, they should be essentially acting as that baseline for detecting whether your QMS is effective or not. So when you have externals come in, customers, certification bodies, they should be able to see, right, you've got really good auditors that are qualified, competent, well experienced, raising well written non-conformances that can be identified in your system. There's nothing I'm detecting here. That is where it becomes really powerful. If there's not good auditors there kind of conducting these audits in a really well planned audit program that's looking at the areas that are causing you concerns, so loads of change going on in your business or something like that, or complaints, then it creates this risk that you're not getting the best out of your internal audits, which is such a shame because
Exactly.
it's a mandatory requirement. You can't avoid it. So why not get the most out of it?
Exactly. Yeah. Yeah. Use. I mean, you have to do it. So use it also to really try to identify all the issues before, as I've said, another auditor, external auditor is coming and finding them for you, which is really a bad. This is the baddest situation possible.
Yeah,
So
yeah, that's what we don't want. And then yeah, look at these little tips that we've gave. We can publish a bit more information on this if people find this beneficial, and consider all of this information that people are putting out around internal audits as part of planning that audit schedule, and use it as a basis to make the decisions on how you're going to plan your audits. Because if you do the same audits every year after year, that's a non-conformance,
exactly.
basically,
Yeah.
because it's not risk-based. So
Exactly, yeah, exactly.
a nice one.
They should not find twice or three times the same issue. Otherwise,
Yeah,
it's like a big problem. You have a big non-conformity there.
yeah,
Okay, so I think yeah we covered everything.
yep.
A long episode. So I hope it will be really beneficial for everybody. If you, I mean, because when we discussed with Adam, we had a lot of the non-conformities that were listed, but at the end to really make a small episode also, we said okay, let's go for one for each clauses. But yeah, there are lots. So to be honest, so this can be something that can go for another episode. So if you have other question or if you have also identified some common issues within your audits or when you are auditing also yourself. So don't hesitate to put that on YouTube or on the LinkedIn posts so that it can also benefit others because it's really important to share that. More we share, more people will learn about it and more they will solve the problem and more then there will be no issue for the products on the market also. So this is mainly the objective of all that. Okay, Adam, so how can you help maybe companies that are listening to us now?
So I can help do some internal audits for people, help them plan their audit schedule. I often sit down with manufacturers and help them design an audit schedule. So I'll ask them what's going on in the business and help them put together a schedule that's pragmatic and risk based, and will stand up to an auditor. Doing gap assessments as well is another area where I kind of go into companies and do those audits for them in anticipation for, say, stage 1, stage 2, or certification audits. And then also kind of just general kind of bit of internal audit training and coaching on how to undertake audits and how to get the most effectiveness out of them. So that's generally where what I do most with audits.
So don't hesitate to contact Adam. He will all the details will be on the show notes, and then he can help you. And yeah, you'll see his white hat. Maybe we'll come with the white hat next time.
Maybe I should, yeah, maybe I should get a white hat.
Exactly, you should get a white hat now, just to show that. Okay, Adam, it was really a pleasure. Thank you very much for
Thanks, Monir.
sharing with us all those information, and I wish you a nice day.
You too. Thanks for having it. See you soon.
Bye bye.
Cheers.